Welcome back to MadeToBeWhole. This is Krista. Stay tuned for our discussion on the blood-brain barrier.
MadeToBeWhole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on MadeToBeWhole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing.
So welcome back to the podcast. We are going to talk this week about the blood-brain barrier, what it is, how it impacts your health, what it puts you at risk for if it's compromised, how to protect it, and also how to choose treatments that can cross the blood-brain barrier. So what the blood-brain barrier is basically our brains were designed to keep stuff out because we want to keep the bad things out. So the endothelial lining, what that is the lining of your blood vessels. The endothelial lining of the blood vessels in the brain is different than the endothelial lining in other blood vessels. It's much, much tighter and much, much more selective to protect the brain, which is great. Unless we need to get there because there's something that's there that shouldn't be there. And then we have these challenges of how do we get our treatment to the site that is effective. And it's not super straightforward. We have to make good decisions about meds and supplements, avoiding things that compromise the integrity of the blood-brain barrier, doing things to kind of manipulate it. The blood vessels that are most involved of the blood-brain barrier, where it's mostly found, are the capillaries, which are your tiniest blood vessels. So that obviously acts as its own selective mechanism as far as what can get in and out of the brain. So the tight junctions, you hear a lot about, I'll back up, leaky gut. So if you have an impaired blood-brain barrier, it's kind of like leaky brain. It's been caused that where you've got stuff seeping in and out that shouldn't be there. And we have to, first of all, prevent. That would be my goal for everyone, is to not think about the blood-brain barrier once you have an infection with neurological implications, once you have Alzheimer's or another neurodegenerative disease, but to think about it ahead of time, saying, hey, this organ I want to protect because that's going to be a big deal. Because again, once something has gone wrong there, the challenges of getting treatment there are really difficult because not everything can pass through that. So you can give medications that aren't effectively passing through the blood-brain barrier. And then because of that, you have excess amount building up in other organs of tissues of your body. There's an interesting article I found that we'll post in the show notes. It's called The Blood-Brain Barrier: Structure, Regulation, and Drug Delivery. It's from the journal Signal Transduction and Targeted Therapy in 2023. So I'm going to reference that because it gives us, I think, some really helpful information and background. So a breakdown in the blood-brain barrier is a hallmark of some diseases, of some neurodegenerative diseases like Parkinson's, ALS, MS, Alzheimer's. What I am interested in is how did that happen so we can keep people from getting there. We know that once someone has a neurodegenerative disease, our best bet typically at that point is to do whatever we can to stop the progress of the disease, or at least to slow it down. Sometimes we can regain function, but it's so much easier to prevent it. Parts of the blood-brain barrier include endothelial cells, which we talked about, the lining of your blood vessels, something called astroglia, parasites, and junctional complexes. The amount of the mitochondria, which is the energy-producing part of your cells. So the amount of mitochondria and the endothelial cells of your blood-brain barrier are actually much, much higher than the amount of mitochondria in the endothelial cells outside of that area of the body. So the endothelial cells of the blood vessels in your arms and legs and trunk. I also think it's interesting that because of the electrical charge, it's really difficult for immune cells to enter the blood-brain barrier. So once an infection gets in there, it's designed to keep it out, but we know what happens. It's hard for your immune system to get the right warriors, for lack of a better word, across enemy lines in there to take care of it. Astrocytes, we mentioned those in the central nervous system. Astrocytes, which are part of this blood-brain barrier, play a major role in dynamic signaling, such as cleaning waste, tuning brain blood flow, regulating vascular function, ion homeostasis, and balancing neuroimmune responses. So a lot of words there, but astrocytes or astroglia are a type of glial cell that are really, really involved in the blood-brain barrier, but they're needed to function. We need it so that we can take out the trash, so that we can get good cerebral blood flow and have it regulated. Blood-brain barrier also, besides keeping bad stuff out, so that's a big part of it, it's also really, really involved just in homeostasis and getting the important things in and out of the brain at the rates that they're supposed to be. And that includes some of the basics of life, which are sodium, potassium, calcium, and chloride. Those are super, super important. So you need a functional blood-brain barrier to have a regulated flow of those things in and out of the brain. Now, most of what I find in the literature when it talks about blood-brain barrier regulation and disease are about neurodegenerative diseases, which we mentioned, but brain tumors, cerebrovascular disease. So what that is the blood vessels in your brain. Cerebral means brain. Vascular means blood vessels. So those things we always think of leading to a stroke. But again, we don't want to wait until you have a stroke. We don't want to wait until you have Alzheimer's. We want to do stuff now. There are a lot of really interesting concepts in the research and development stage about getting things to cross the blood-brain barrier, but not all of them are really suitable for hands-on care right now or super relevant to my patient population. So I will mention some of the more technical, advanced modalities, but I'm going to focus more on the things that I think are beneficial right now. So some of the ways that you can get to the blood-brain barrier, obviously by injecting something intrathecally, which means basically into the nervous system. You're going to inject something into the cerebral spinal fluid so it can circulate. That obviously carries risks of its own. It's invasive. One of the things that I find most interesting, and I have seen firsthand the effectiveness of this, is intranasal administration. So that means basically putting something up your schnoz, using a nose spray. We've mentioned it in other episodes, how that can be really, really helpful for MARCoNS, which is a bacterial infection, mold illness, that sort of thing, spraying something directly into the nose. And there are a couple of different ways that things can get from your nose to your brain. One of them is through the olfactory nerve. One of them is through the trigeminal nerve. And then the other one is through the lungs and the GI tract, because if you think about it, anything here, a couple of things happen. You sniff, you snort, you whatever. Obviously, anything in your nose is entering your respiratory tract. So that would be your trachea, your lungs, but also your GI system, because we sniffle, we swallow, things get into our gut, and then we've got that connection between the gut and the brain. If you think about it from a purely mechanical perspective, it's also a very, very short route from the nose to the brain. So we can deliver medications kind of at high speeds, at higher concentrations, and get it where we want to go more effectively and more quickly. Now, the downside of that, or at least something that we need to be aware of and have caution with, because of that effectiveness, we can trigger psychiatric or neurological herxing if we're using, for example, an antibiotic intranasally. I have told the story before, but my son Daniel, when we started the Marcon's nasal spray, because he had a positive nasal swab, he had significant psychiatric herxing. And so what we did is we peeled it way back. We started with a squirt once a day. We worked up really, really, really slowly. I want to encourage you again. I know that the temptation is, if something makes you feel worse, to just stop it and say, oh, it's too much. My body can't handle this. Sometimes it may be wise to abandon a course of treatment or put it on hold for a while. But many times having something stirred up like that, unless it's an allergic reaction, obviously if your airway swells and you can't breathe, that's not something we're going to push forward with. That's dangerous. But if it's stirring up some of these neurological or psychiatric symptoms, it means that it's being effective. It's getting at the source. So why don't we stick with this, but start with a much lower dose, go much, much slower, and titrate up as the body allows. Now, some things that could make this a little difficult are the anatomy of your brain. Plus, if you have, not just your brain, of your nasal passages. So if you think of people with a deviated septum or with just really maybe tight, small nostrils or nares, they're called. Also, some people aren't as skilled at how to administer it. I know it seems really straightforward. Well, you just squirt something up your nose, but it's kind of an art. You need to kind of snuff. You take a quick sniff in, but you don't want to snort, because what you don't want to do is put all that stuff up there and then it all goes to the back of your throat and down and you swallow it and it's not sticking where it needs to be. Also, you have to be careful if you're using other things intranasally, just a lot of kind of technical things. One of the things I also think about when I am recommending things like this is the person's ability to give themselves an intranasal drug. And it would be a fair question to say, well, how's that hard? It's not hard at all. I always hearken back to my home care days where I had an older patient who had COPD and she was very frail and very weak and she shook a lot, and they had her on this very complex regimen of different inhalers. And I'm watching her thinking, sure, these are some of the best drugs on the planet for this, but she lives alone. Her hands are weak. They're shaking. She can't coordinate this activity to properly use the inhaler. This is not effective treatment. So if somebody has severe arthritis in their hands or weakness, they need to have another family member who can help them, or else it's probably not the best mechanism of action for them. We need to find something different. Another thing that is cool about intranasal administration, not just for medications, but also for other things that can have a big impact on the brain. One of them is NAD. NAD is fairly popular in the wellness space, and you will read a lot about IV NAD. IV NAD has to be administered over several hours. You have to do it really, really slow. IV NAD is fairly expensive. It does really help people, but obviously IVs are a little more complex and more difficult to work into someone's daily routine. There's a little more cost involved, but super, super cool. We have the way to give NAD intranasally. We have a few compounding pharmacies who will make that for us. One thing that can be added to it, so in the world of compounding, we can customize what we give. So sometimes the combination of NAD plus oxytocin can be very, very calming. So that's a pretty cool thing that typically we're not going to have die off from doing anything like that. As long as, again, we're starting low, going slow, it can be super, super effective. Now, one of the other things that helps open the blood-brain barrier, and you have to be careful with this. I'm going to step back here. Of course, we want to be able to penetrate the blood-brain barrier when we're giving medications, so for central nervous system infections, anything that might be affecting the brain or the nervous system. But if you compromise the blood-brain barrier further, that also means bad stuff can get in there or good stuff might come out that shouldn't be there. So what we want to do is work with the blood-brain barrier and not do anything that opens it in a harmful or long-term way that's going to put someone at risk. But one of the things that helps to open the blood-brain barrier is light. If you think about how light deprived our lives are, there's a lot that can be said for natural light, but also red light therapy increases mitochondrial function. I think combining red light therapy to the head, obviously you can use it for other areas with different modalities, can be a complementary thing to do. Where I see people get a little bit in trouble with anything, it can be with traditional medicine, with herbs, with red light therapy, with things I love like neurofeedback or plasmapheresis, is when they say, oh, this is the answer. I want to do red light therapy and that's going to take care of all of it. Well, typically not for most people. It doesn't mean it can't be part of the solution and it can't be synergistic with other things, but just because something is necessary or helpful doesn't mean it's sufficient. There are some interesting studies about ultrasound and using ultrasound to non-invasively focus into the body and create vibrations that can make that barrier a little more permeable for a period of time. So I think that's interesting. There's something called electroacupuncture, which I wasn't as familiar with, but this study cites it. It says electroacupuncture is a widely accepted complementary therapy stimulating acupoints. Studies found that electroacupuncture stimulation at certain parameters could improve the permeability of the blood-brain barrier. So super cool. But again, you need to find skilled people that are working together to make this effective. Don't go all wellness warrior on yourself, biohack, I'm going to cure my neurological infection with the hodgepodge of people I found online who know a little bit of this and a little bit of that. It scares me. I think you need to be really careful. When you're talking about oral choices for medications or herbs, it's really, really important that you choose the right form. So liposomal formulations of things are more effective at crossing the blood-brain barrier because the blood-brain barrier is lipophilic. So it's made of lipids and it attracts and lets things that are lipid based through and repels things that are water based. So if you think about the old adage, oil and water don't mix, it's very true in nature, including in your body. So things that are simply water soluble, they're not coming in. They're not coming in. So if you can use a liposomal formulation of a vitamin or nutrient, or there are some medications that are liposomally formulated, not a million of them, but that's another option to look into. And also think about how you get it there and what stage of illness you're in, because for an acute illness, certainly IV antibiotics would be the best way if you have a nervous system infection to get things there, because you also have to have a high enough concentration of medication, nutrients, whatever, to cross the blood-brain barrier. So if you think about the blood-brain barrier as a really, really fine filter, you're going to have a much higher volume to get an adequate amount where it needs to go. This is an example of why the standard nutrient testing isn't always as helpful. You can have really high plasma levels of a nutrient, but it may not be effectively getting into those hard to reach places. So you have to look at other delivery systems like liposomal formulations, sublingual formulations, injections. The genomic testing that we've talked about, Intelix DNA, gives us some really, really good insights into whether or not you're someone who has difficulty absorbing B12 in the gut, but also if you're someone who has difficulty getting adequate B12 to the brain. So that's helpful to know, even though your numbers might look good on paper. If we know that's your genetic vulnerability, it still would probably be a good idea to try some B12 shots or at least something sublingual to bypass that to keep you from having problems. Don't wait until you have memory loss or neuropathy. Do something about it proactively would be my recommendation. So IVs bypass the gut. You have to use them appropriately. Sometimes I hear people talk about, well, I want to pulse it. I want to do it this often. I read so-and-so did this. But remember, effective treatment, you have to have the right drug at the right dose for the right duration. We have to give it often enough that we keep high enough levels in circulation that we can get a therapeutic dose where it needs to go. And that varies widely from medication to medication. There are some medications, IV or oral, that have to be given every 6 hours. There's some that can be given twice a day. There's some that you can give 24 hours a day. But one of the things you need to take into account when you're choosing it isn't just the convenience of dosing, it's whether or not it's the appropriate dosing regimen for that medication, so you're getting something out of it. Now, it's interesting, there's some good information out there on things that cross the blood-brain barrier more easily, medication-wise, supplement-wise, but also lifestyle type things that you can do. So the reason that nutraceuticals can really impact your blood-brain barrier function and integrity is because of what they're made of. So if you think of what I said about that lipid layer of your endothelial cells, so it's made of these fats, you need the right amount of fats to have a healthy blood-brain barrier. So that's why something like omegas could be a really, really good add. Now, for the most part, I would say most individuals can take omega-3s, DHEA and EPA together, because those are structural components. But if you're having a lot of neurological symptoms, I think it would also make sense to do some more advanced testing to see what are your specific deficiencies in that areas, what is imbalanced. Other things, and the omegas can cross the blood-brain barrier to an extent. So other things that can also do that can be a good part of healing, acetylcholine, which is CDP choline. It helps with synthesizing the phospholipid in those membranes. It helps your body repair nerves better and can improve blood-brain barrier permeability in the context of neurodegenerative diseases. So when you're looking for products, I don't have any affiliation with most of these companies. Some of them I use more extensively in my office, but I like to give you a shout out and give you examples of things we found that are quality that can contain that. So Cognifos from Pure Encapsulations, I really, really like that. COGNIPHOS. So it has acetylcholine in it, which is what we talked about, but then it also has phosphatidylserine, carnitine, a little bit of B6 and zinc, and has some excellent properties for getting to the brain. Whenever you have a product that you think, well, this is called Cognifos and I'm taking it for acetylcholine, why does it have all this other stuff in it? There are a lot of products out there that may be a good form of a nutrient, but if it doesn't have the right cofactors, it's useless. So what that means is, I've talked before about how chocolate chips are necessary but not sufficient for good chocolate chip cookies, right? You can't have good chocolate chip cookies without good chocolate chips, but you have to have the other ingredients and conditions. And there are a lot of nutrients that absorb much or are absorbed much better by your body when they're taken with other specific nutrients. They work synergistically together. So that's a great one. Cognifos from not from Orthomolecular, from Calm Mind. And I can give links to these products as well in the show notes. Another thing that is helpful, lion's mane and bacopa. I take products with both of these things in them and have found them to be super helpful. Again, I chose these because of my genetic results. It wasn't just, what could I take from my brain? Though you could certainly give it a shot. But what I did is I combed over my Intellix report, and I looked at, okay, I have a lot of cognitive symptoms, I have a lot of anxiety. What do my genes tell me about that? And what would be a good place to start? So, lion's mane and bacopa are two excellent ones. The lion's mane stimulates BDNF, which is brain derived neurotropic factor. And you have to have that. It's like fertilizer for the brain. So it helps your body make new nerves. It helps the health of your blood vessels. That can support and strengthen the blood-brain barrier. Bacopa reduces oxidative stress. It reduces inflammation, and it can improve blood-brain barrier function over time. Again, a lot of the things you're doing when you're not doing prevention, particularly if you're looking at repair, it's going to take likely higher doses and a longer period of time. Now, the two products that I use that have these ingredients in them, one of them is BDNF Essentials, which is from Research to Nutritionals. I really, really like this product, but it has lion's mane in it. It has bacopa in it. It also has acetylcholine, which we talked about, phosphatidylserine, as a little bit of ashwagandha, some other plants. I like it quite a bit, and I have plenty of patients who say, oh, I really feel a difference with that. And even patients, I thought it was interesting, who I felt certain that their cognitive issues, like their brain fog, were much more related to babesia. But they still, once they started the BDNF Essentials, they felt something. They're like, yeah, I'm not going to stop taking that. The other one that I take is I take something from Thorne called Memoractive, Memoractiv. Memoractive has ashwagandha in it, which helps me and my cortisol tremendously. It has carnitine, it has ginkgo, it has a little bit of caffeine. It's got bacopa, it's got lutein. It's kind of marketed as a natural ADD type product, but I take it in the mornings because it checks a lot of boxes for me. I had lower carnitine levels on my most recent micronutrient test, so I want to bump those up. My genetic report references ashwagandha a lot, and I find it very calming. The bacopa has been very helpful for me. I just like it whenever I can find a product that kills two birds with one stone, or three or four. So those are the two things that I use that have those ingredients in it. There are other products out there, and if you have something you love, let us know. We'd be happy to pass it on. Another one that is really helpful is curcumin, also known as turmeric. It's anti-inflammatory. It's an antioxidant. Now, it is very, very important when you're looking at curcumin and you're looking at the brain. Remember, what's good for inflammation in the joints or in other areas of the body doesn't mean it's going to reach here. There's a form of curcumin called theracumin. Theracumin has excellent properties for crossing the blood-brain barrier and reducing inflammation there. And you can do that on a preventative basis or at a higher dose if you have symptoms of this inflammation, which could be anxiety, head pressure, dizziness. Taking higher doses might really help you to manage your symptoms. So the two products with theracumin that I really, really like are, drum roll here, one of them is called Luma, TCLUMA, and the other one is called Calm Mind. So Luma has been studied in the context of preventing and treating Alzheimer's disease, and it contains theracumin plus some other ingredients that have been shown clinically to improve brain function. So it's got the theracumin, it's got a really low dose of lithium orotate, which is nutritional lithium, just 5 milligrams, but that's got good cognitive benefits. It has N-acetylcysteine, L-methylfolate calcium, a low dose of methylcobalamin, which is B12, and a low dose of P5P, which is the activated form of B6. Some of the things that they have shown through their studies that it can prevent, stop, and even over time remove brain plaques and tangles. It can prevent the inflammatory activation of the microglia that we talked about. It can prevent and reduce brain inflammation. It can prevent and reduce brain oxidative stress. And it's also been shown to restore lost gray and white matter. And increase the connectivity of dendrites, which is how your nerves talked to each other. Tony Robinson, really smart, really nice guy. He is the one who invented this. He's also the one who invented Embrace that I'm in love with because of how I see it help people. He says, what drugs are available may temporarily diminish Alzheimer's symptoms, but none addresses the underlying mechanisms of the disease. Luma-TC safely addresses the root cause of the disease process. So if you are taking Luma, which you can get from their website, but you can also look at AHP's online store, we carry it. If you look at Luma and the dosing and you're doing it strictly preventative, 1 tablet a day is fine. But if you're symptomatic, you can do 1 twice a day very safely. I did 1 twice a day for a couple months, and then I dropped it to once a day. And then what I add for faster activity is the Calm Mind that I mentioned. So Calm Mind also contains theracumin, but a higher dose. The Luma is 180 milligrams of theracumin. Calm Mind has 300 milligrams of theracumin and 15 milligrams of saffron in it. It's super, super clean. What I've been impressed with Calm Mind is how quickly people get relief, even people who are super, super, super anxious. I have recommended this to some of my people with really extreme Bartonella symptoms or other things that are triggering anxiety, and they feel some relief pretty quickly. So that's really exciting to have something that works that way. If you look again at the dosing, it says serving size 1 capsule. You could take this on an as needed basis, but if you have ongoing inflammation, I would just recommend taking it routinely until the inflammation has been calmed down. You can take it routinely once a day. You can take it routinely twice a day. It's completely fine. You find something that works for you and you can incorporate it. You should always ask, though, don't just because it's natural, you can make the executive decision to just take more and more, and there's no ceiling on how much you can take because, everything has its limits. You can even drink too much water. That is possible. So use good judgment, because every once in a while I have someone who comes and I say, oh, how many are you taking? Oh, I take 6 twice a day. And that stresses me out a little bit. Other supplements that can help maintain the health of the blood-brain barrier, they don't all necessarily cross the blood-brain barrier, but they help the health of those blood vessels in the endothelia. One of them is maintaining an adequate vitamin D level. It helps the integrity of the endothelial lining, the lining of your blood vessels, and regulating the immune system within the central nervous system. My personal opinion is there are very few people living on a modern lifestyle, living in the United States and probably most of the world, but I'm going to speak for the people I've evaluated who don't need vitamin D. It is so difficult to get enough vitamin D through the sun, especially if you do things like wear clothes and sunglasses and sunscreen, because that impairs the absorption. And then you look at how much time we all spend inside just working. So go get vitamin D, get in the sun. That's great. But watch your levels. Most people that I care for, I will recommend vitamin D for life. Very, very rarely does someone living in our modern age and a modern lifestyle have good enough levels. And this even includes, my farmers and rural people who are outside all the time, because they're not outside all year. They're usually wearing clothes. They usually have a hat or something off blocking sun absorption. It's just really super important. I have mentioned before, but it bears repeating, that ideally vitamin D is taken with K unless you are on heparin or Coumadin or have some other contraindication to K, but they work synergistically. K helps act as air traffic control to make sure calcium gets to your bones and not to your blood vessels. But vitamin D is a very, very basic intervention that we should not take for granted. No matter how you feel, you want good vitamin D levels. And if you are doing a test from just the hospital, LabCorp, Quest, CompuNet, whatever. Ideally, you want that at least 60 for the sake of your immune system. They're going to say it's normal once it's over 30. It's not sufficient. You really want it over 60, and that's not something that you want to let go of. L-theanine can be calming. It reduces oxidative stress, and it can help the endothelium work better. And then resveratrol, which is grapeseed extract, is an antioxidant. It's anti-inflammatory. It can be protective. My favorite form of resveratrol personally is Vinia. It's a long-acting resveratrol. I had tried regular old resveratrol previously because they are antimicrobials, so I was adding it to the treatment for my vector-borne infections, but I had a lot of die-off. I would feel worse afterwards. I felt like there were a lot of crashes. Well, then I found out that resveratrol peaks in about 15 minutes and then drops. So Vinia is this long-acting formulation proven to increase nitric oxide levels. It does so many good things for the heart, the vascular system generally, but specifically the vascular system in your brain. So I would strongly recommend that if your brain's working well right now, you don't take it for granted and you do the basic things that you can to protect it. I think most individuals would be served well by taking vitamin D and omegas and a good B complex. That's kind of 101, I think, for most people. Because also with vitamin B, I'm going to jump back, like B12 specifically, there are multiple common medications that deplete B12 levels. So if we are also treating people with things to bring that down, if we're giving them metformin or PPIs, we've got to compensate for that. We've got a generation of people who are being thrown statins like candy. Not only is that not great practice, but statins deplete CoQ10. If you really feel like someone needs a statin, and there are a few people who do, you should be aggressively pushing CoQ10, helping give your body what it needs to repair, to heal, but also to prevent disease. I'm going to jump now to medications that cross the blood-brain barrier. So this is super important when we're talking about our vector-borne infections, Lyme disease, Bartonella, Babesia, all of these things. If you have neuropsychiatric symptoms, you can take all the herbs and antibiotics in the world that are great and have great activity against Lyme, Bartonella, Babesia, and they may improve some things. But if you've got infection here in the noggin, you have to take things that get to the noggin. So you're not going to overcome encephalitis if it's infection triggered without medications that permeate the blood-brain barrier. Some are better than others. It has to do with, like we mentioned before, the lipid solubility, the size of the molecules, pH, whether or not there's inflammation there, a lot of different things. So there's a category of medications called beta-lactam antibiotics, and especially the third generation of cephalosporins. So cephalosporin is a broad category of antibiotics, but there's first generation, second generation, third generation, fourth generation, and one generation isn't necessarily better than the other. They just have different properties, but particularly those third generation cephalosporins have good CNS penetration, and third generation cephalosporins include ceftriaxone, which is what in the infectious disease world they'll typically use first line. If they're doing IVs, they'll say, oh, we're going to give you 4 weeks of ceftriaxone. And that is certainly a good intervention. I honestly, like everything else, I have not found it to be sufficient, that it can help, but you've got to be looking at biofilms. You've got to be making sure you've identified all the proper co-infections, that you're treating those, that you're treating inflammation, that you're supporting the gut. There's so many different elements to that, but that can be part of effective treatment. So I'm going to give you some other examples of third generation cephalosporins. Ceftriaxone is the most commonly known one. Cefotaxime, I hate saying these sometimes. ceftazidime and sulfoperazone, which has been discontinued some places, but here in the good old US of A, it's mostly ceftriaxone that we work with. It can be given as an IV. Sometimes we give it as an intramuscular injection. That can be pretty painful, so I almost always will have that dissolved in some lidocaine so that I'm not causing pain and suffering for my patients. That's not what we want to do. Penicillin G and ampicillin can get to therapeutic levels in the cerebrospinal fluid. That's important for some specific infections. Carbapenems, which is meropenem, imipenem, penetrate the central nervous system and the blood-brain barrier, but they have to be kind of carefully dosed and monitored. They're a little ruffle. Metronidazole. Now, I think this is one reason why metronidazole causes so much herxing or die-off. Metronidazole, sometimes called Flagyl, that's the brand name of it. It's got effect against Lyme biofilms. We have a lot of people who we use it because they show up with Prevotella very frequently in urinary tract, vaginal, or prostate infections. But metronidazole has excellent blood-brain barrier penetration, but that means die-off can be hell. And I speak from personal experience. I distinctly remember the month and the year that I started metronidazole and what my brain felt like for several weeks, and it was not pretty at all. But if you're herxing, it's worksing. That is a reason, in my opinion, not to necessarily discontinue metronidazole, but to lower the dose, to lower the frequency, to ease into it, and then to make sure that we're doing a lot of anti-inflammatory compensatory things because we're triggering die-off. Trimethoprim sulfamethoxazole, which is a big mouth word for Bactrim, which is most commonly known, can get through the blood-brain barrier. So it's a good choice. I have some people who feel really good on Bactrim. Rifampin, again, you want to be using it with other things, but it's got excellent penetration of the central nervous system. I very, very frequently recommend it if people have neuropsychiatric Bartonella. I have had a difficult time effectively treating people without it some time, including rifampin or rifabutin, which is similar to rifampin. They're related, a little different, definitely more expensive if you don't have insurance coverage, but I really struggle with those neuropsych infections if we're not including that at some point. Now, to me, rifampin's kind of big guns, and I don't add it at the beginning unless there's some super compelling reason, which I haven't run into yet. I want you to do some other things first. I want you to lower that load before we bring that on. Another thing I want to bring up, things that do not cross the blood-brain barrier that you really, really, really need to be aware of include macrolides, which is like your azithromycin and your clindamycin. They're not good. They may have effects against Bartonella, but they don't have good CNS penetration. That means getting through the blood-brain barrier to the central nervous system. And so even though they can be part of a Bartonella treatment plan or a Lyme treatment plan, if you have neuropsychiatric symptoms, azithromycin is not going to be sufficient. So that's a little mini medical lecture, I guess, but I think it's important to keep in mind because, like I said, it's human nature that we really, really want to find that magic bullet, right? We want to find the thing that's going to help. It's a constellation of things. We're especially if you're already chronically ill, we're putting Humpty Dumpty back together again, and we have to make educated decisions about which things we use and in which combination, and we have to look at how it affects you, but also what do we know about your infection and about your body, and what can we do that's the most effective. A few other lifestyle things that have been shown to help in this process, other than we talked about red light therapy, intermittent fasting, even neurofeedback training can be really, really helpful. People who are at extra risk for a compromised blood-brain barrier, other than once an infection is there, it has become chronic. But think of your traumatic brain injury patients. So if you've had a traumatic brain injury, which unfortunately a lot of individuals have via sports, car accidents, multiple other things, violence. If you've got that TBI history, you have a compromised blood-brain barrier, so you need to work extra hard at rebuilding it and keeping the bad stuff out. Because we know inflammation can be so detrimental, you need to do things that are preventing an offset of that. Having an anti-inflammatory diet, really working on your sleep, learning how to manage your stress. Exercise and activity are really, really important, because exercise and activity increase circulation to the brain. It increase brain health. They trigger the production of BDNF, that brain-derived neurotropic factor. Physical activity is really, really important for healthy aging. We don't currently have any really great commonly accepted and available tests for evaluating the health of the blood-brain barrier, but there is some advanced lipid profiling. There is one commercially available test. You can read about it on weprevent.org. They have a blood-brain barrier integrity test, which I think is interesting. I haven't used it, but I'm interested in kind of checking in. But test the things you can that contribute to the health of that organ. So look at your omega levels, look at your choline levels, look at anything you can that you can optimize and have control over, so that you can take charge of preventing illness and setting yourself up for healing and for the healthiest life that you can. Life's hard. Things are going to happen. We're all going to get sick, but there are always answers if you keep looking. So remember to have hope, because you were made to be whole.
Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.